This work is named multi-resistant bacteria in ICU in the right path. So we know multi-resistant bacteria is a problem, a severe public health problem. This affecting the morbidity, mortality, and hospital length of stays, including the rise of social and health resource consumption. In Spain, in 2014, the Spanish health system is starting a national campaign. This is called Zero Resistance. This is conducted to prevent the emerging of antimicrobial resistance, especially these multi-resistant bacteria in intensive care units. The objective of this work was to describe the impact of an educational program on the incidence density of multi-resistant bacteria in ICU. In infected patients, dividing them into extra and intra-ICU admission as a secondary objective to describe multi-resistant bacteria frequencies. As I was telling you, in June 2014, an educational campaign was driven by ICU teams. This consisting in the implementation of 12 preventive measures. This measure was in different areas like preventing infection, effective diagnosis and treatment, correct use of antimicrobial treatment, and prevent transmissions. This observational study was based on embed helix database of the patients who had multi-resistant bacteria positive cultures. This was identified the microorganisms at admission and after 48 hours of ICU admission, including infection and colonization. This was undergoing during the year 2014 in the ICU of 18 beds. We analyzed the frequency before and after the intervention and after the implemented campaign. This is the results. In 2005 ICU admission, we had 47 multi-resistant bacterial cultures. After 48 admission was 28, at admission 19, and talking about infection and colonization was 25 infection and 21 colonization. For analyze the incidence of density of this bacteria, we worked only with infections. Before the intervention in June, we had 27 multi-resistant cultures with an incidence density of 4.26. After the intervention, we had 20 multi-resistant bacterial cultures with 11 infection, 3.77 incidence density. We had reduction of the incidence density of 13.85%. What is the reason we had a conclusion that we are in the right path because we have been achieved as we reached it. Besides, we had this reduction. Our incidence is still above the national average. Talking about the frequency of these multi-resistant bacteria, Acinetobacter baumannii was the most frequent, and the less frequent was the gram-negative bacteria Carbapenem venace. Thank you.
Thank you very much. Is it working? Thank you very much.
Okay, thank you.
Questions from the audience? Yes, please. Not sure how this is going to work. Is there a...
Do you perform surveillance cultures in your unit, or just is the clinical culture?
Okay, I'm not sure if I understood the question.
Do you use surveillance cultures?
Oh yeah, yeah. We work together with the microbiology laboratory. When some culture is positive, maybe it's started to grow up something, they call us and give advice.
But do you use routine surveillance, or is this only clinical isolates? I think that's the question. Are these infections, these multi-drug resistant organisms, were they infecting organisms or colonizing?
Both.
Both.
In the first was infection and colonization, but for making the incidence density was only one infection for working in statistics.
Okay, thank you. Any other question? No, if not, I think it's time to move to the next speaker. Thank you very much, Dr.
Thank
Costa.
you.